Hi, I'm Senator Kemp Hannon. Welcome to my legislative report. Now, let me just put it to you this way. With the experience you have in internal medicine and all, if you're a mom and then you have a daughter, what do you start to tell her besides the reproductive health medicine? How do you, what type of guidance would you give her in terms of you're now 5 years past your well baby visits, that wonderful set of protocols we have for young children. We don't have to invent it for young children. That's all done. But we don't have well baby visits for teenagers, for the 20s and 30s. What would you start to advise as how do you approach health?
So for teenagers in particular, it depends on whether or not they're actually active in sports. There are recommendations that if a child is playing sports, that they get a sports physical every year. That's to assess cardiovascular risk, also make sure they haven't had a lot of injuries. Concussions, there's a lot of literature out there for teenagers with particular sports, even soccer. Cheerleading for girls, okay, so it's not just football and wrestling and things like that for the boys. But, you know, children do need regular checkups with their physician because they're still growing. So, you know, your height and weight is pertinent to your health, and there are guidelines for overweight, healthy weight, and obesity in children. So those are really assessed at the physician's office as well. Once you're beyond your high school years and you're in college, I mean, you enter college, you usually need a physical. Depending, again, if you're playing sports, you may need more frequent physicals. But, you know, again, you know, it gets back to what you're doing for mom. You know, what is your blood pressure? We do diagnose high blood pressure problems in even children who are in 6th and 7th grade. So, you know, it is important to have those things monitored, even high cholesterol problems. You don't know until you check, and the person who can do that for you would be a primary care provider.
Now, a lot of times, you see a physician, a pediatrician has to see an individual till they're 18, and then there's a handoff. I've never was totally sure of exactly what the protocol was.
So there's pediatricians and internal medicine doctors are both trained in what we call adolescent medicine, which is typically, the guideline is somebody over the age of about 13 or so. So typically before the age of 13, the care would be provided by a family practice doctor or a pediatric doctor. Between 13 and adulthood, it could be either one of those or an internal medicine doctor. So internal medicine doctors are trained in adolescent medicine as well. I think it probably depends on what's available in your particular community. There's, you know, on the West Coast, there's a lot of family practice doctors. There tend to be more pediatricians and internists on the East Coast. And of course, we know there's big differences between what's available in a rural setting versus what's available in a city type setting.
But how do you do the handoff? Or is it try to go to like the practice associated with the particular hospital you're located near? We got 3 or 4 hospitals that are right down the spine of my district, New Island and UMC, yep, and Winthrop and Med-Mercy. So I guess you try to pick somebody associated with the hospital so the pediatrician can say, oh, I know a couple of internists or something like that.
Absolutely, and we do get referrals. My practice is unique. We are both an internal medicine practice as well as a pediatric practice, so we can follow children from birth through grandparenthood, I guess, if you want to say. But we do get referrals actually from other pediatricians who say, you know, this person is now 19 years old, we don't want to provide the care anymore, will you take them on as a patient?
Now once they get to be 19, you do a baseline with the internal medicine clinician, and then how often after that?
Well, again, it depends on their personal risk factor. So, you know, remember, obesity is a chronic disease, and unfortunately 2/3 of the adult population in the United States is either overweight or obese. Being a chronic disease, it's kind of like high blood pressure. You don't see, if you have high blood pressure, you see your doctor more than once a year, and hopefully with obesity management, what we can get to is really trying to provide more regular care for people to help them with the problem, because it's a lifelong problem, and it has a lot of comorbidity associated with it, like heart disease, diabetes, lung diseases as well, things like asthma, sleep apnea. So there's a lot of medical concern when it comes to overweight and obesity, which unfortunately is very common.